first thing with 4 buckle is your stool is gonna go as, I guarantee you, as high as it will go. All right, for you who are really small and your legs are dangling, you can put your feet up on the crossbars in clinic and here. Okay? But you will need it as high as it can go in the clinic. All right. The other thing is this patient chair is going to be as low as it possibly can go. That doesn't mean Trendelenburg, right? It's still a perfect supine, right? But the whole base of the chair you might have noticed that you try to get it lower and then it comes back up a little bit. Okay, there's a bypass for that. You have to get rid of, if it does that, comes back up, it'll have a little code in the thing saying, you know, sense the whatever, safety, I don't know. Put it up a little bit to get rid of that, and then tap it down instead of holding the button. Tap it and it'll go, and it'll bypass that safety and you'll be able to get it as far down as you can. Provided the rheostat cord isn't laying over those bumps in the gray, you know, those little tubey bumps that come out of the gray base. The cord can't be over the sides of those, or it won't go all the way down, because it'll say the cord is here. All right, but that's really helpful because it really does. So today, make sure they should be that your typinette is all the way down as low as it can go. All right, so you're going to be in C, and here's patient positioning, head. All right, when we talk about patient, we assume you know it's supine. We're talking about the head. A maxillary mandibular, of course, that's easy, right? But now you got to really start to think about all the head turn. Well, you did with the anterior too, right? So for the beginning today, I want you to take the tissues right off so you can really see this in the beginning when you first start. You want to sit upright. You don't want to have to do this, right? Because the patient is here, all right? Right? So you have to put your mandibular position, and then you have to turn the patient so that you can see over these teeth, right? So I can't work on these here. I can't see without doing that, and that's going to mess you up because your hand's going to be here and against you, and you're going to be too tight. So you have to be sitting upright, and you have to have it turned enough that you can see the buckle of this whole sextant. So that's patient head, right? The light is going to be a little bit toward D. When you're in C and the light is C, it means the middle of the patient, you know, over the patient, but there's still you can give it a little bit of this to help yourself out. That doesn't mean it's way over here in D or way over here in A. Okay? So kind of coming right in about like that. Right. So tighten this. We'll do the Explorer because they've seen that, because we haven't even practiced the Gracie yet.